on the side. So as we get down here, we have bone spur formation here, but this is also compensatory changes because of the scoliosis, but you also have disc damage here. And so that accelerates this whole thing. So when there's damage to the disc, these discs have crisscrossing fibers like this, annular fibers, and so sometimes they'll pop apart and you have a gelatinous material on the inside. Well, that stuff pushes out. And so when that happens, the body accelerates that whole process that I said. The muscles, all that stuff, all the arthritic changes, it wants to accelerate that because it wants to protect these nerves. The bad part about it is, over an extended period of time, it turns this stuff off. Now, here we go to the top. Actually, let's go to the side view of this low back. Okay, now, side view of the low back. So this is what we want to see, a nice smooth curve like that. The curve is kind of okay, but we want big spaces like this, and this, and this. This is what we got here.
Oh.
I got no spaces here.
Oh, boy.
Yeah, so right there. So there's 3 different stages of arthritis. So it's called osteoarthritis or degenerative joint disease. And so stage 1 is just biomechanical instability. So I'm going to use this chart and the side view of his neck as an example. So your neck's supposed to have a curve in between 30 and 40 degrees. Well, if it's straight like this, you may not necessarily feel pain or discomfort all the time, just excessive tightness here and here. But over time, it does that same thing. It causes irregular wear and tear, and you start getting these arthritic changes. So stage 1 is just when things are out of alignment, but the disc spaces are normal. This is fixable. Stage 2, pain comes more often. Symptoms start lasting longer and longer. We're losing that disc height. And so this is, I can't make this look like that. I wish I could, but I'm not. It's not gonna happen. What we want to do is make you feel like this, but prevent you from getting down here, because when this stays like this, over an extended period of time, it moves to stage 3. And stage 3 is really close towards bone on bone. That's where this is.
Oh, God.
So, stop it. That thing just wants me to stop. So that's where you are there. Now. All right.
Now, what do the epidurals do?
So the epidural is, it's a pain block. And so what they're doing is they're literally going in here, and they're injecting whatever they're going to inject in there, and it blocks the nerves.
Okay.
It blocks the nerves. It doesn't change anything.
Right.
It changes the sensory neurons where you're not feeling it, but that whole process is still going on.
Okay.
So, but that's what I was telling you before. You can only do 3 of those a year.
Yeah.
Because it literally causes this stuff to prematurely just fall apart. Now the neck. The neck. There. So that's what we want to look like.
Oh, my God. That's my neck?
Here's a little different.
Oh, my God. That's frightening.
So the big deal with this stuff is right here. Let me count. 1, 2, 3, 4. So C5, C6, C7. These guys are literally trying to fuse together. This is definitely a stage 3. And so this is a big deal for us, because from here, from C5 down to T2, you got a branch of nerves right here called the brachial plexus. And they control your arms and your hands and your shoulders and your fingers. And so increased pressure here, a lot of the times, you'll start getting radiating pain in your arms or hands or fingers, or shoulder problems. You'll get muscle weakness. Sometimes you'll start dropping stuff. So that's pretty much where we are there. Okay, so we're stage 3 in the low back and in the, I forgot that. And you got a little bit of scoliosis.
How did I get that?
Well, the scoliosis you were born with.
Oh, that's nice. I never even knew that.
Yeah, mom and dad give that to you. And so, and I just had a kid in here. Same stuff. So I see this stuff a lot. I've had 5 offices. I've never seen so much scoliosis in my life as I have in this office. It's more than half of the people that come see me here. And I wonder if it's in the water. I don't know what the heck it is. Or maybe I'm just a magnet for it. But I see it at different stages. And so that's what I'm saying. I just had a young guy here. He was 28. And he, said this stuff happened when he started lifting weights in high school. And that's what he thought started it. And I could tell by the way he was sitting that wasn't what it was. And so he does. He has lateral deviation of the spine. The good part about it is where he is, if he does something about it, he can prevent it from getting worse because he has no arthritis in his body. For you, our job is a little bit different.
Well, I've lived through a lot of trauma and abuse.
Yeah.
And my mother smoked and drank when she carried me.
Okay.
So,
See?
she didn't give me anything good.
That means you're super tough. Because you're still here.
Right.
Yeah, 100%. That's all that means. All right, so this is what I got. So pelvic instability on the right side. So if you stood on two different scales, that right side would always weigh more. And it's because of this irregular thing. So when you walk, this bone and this bone, they're supposed to do this, where they're moving as one unit a lot of times. When I adjusted you, that increased discomfort you were feeling was this. And so this is the sucky part about all this. This is like starting an exercise program. So when you get adjusted, it stimulates the nervous system, it sends those signals up to your spinal cord, to your brain, and it dampens the neural pathways that deal with pain. And pain normally goes away relatively fast, within days to weeks. If there's structural weakness or structural abnormality, you got 5 different layers of tissue, and the connective tissue is short in some areas. And so when I adjust you, it elongates that tissue. It lasts for a day or two, and it goes back to what it thinks normal is. What needs to happen is, as much as that scar tissue needs to be torn up, and it reabsorbs, the body lays down new tissue. What we're trying to affect are the ligaments in between the vertebrae, because when they get as strong as they're going to get, you're kind of maxed out, and you just want to hold it there. So the move definitely, exacerbated this stuff, just with all the moving and lifting or whatever. So you saw a chiropractor before at home, right?
Yeah, now he told me, and dear God, please verify this. He told me that my spinal cord damage, my cervical, goes away from the spine. So, because I said to him, am I ever going to become paralyzed? And he said, no, your problems go away from your spine. Is that true?
Was he looking at this x-ray?
Shit, really?
No, because,
So I could become paralyzed?
no. No, that's what I'm saying. I don't even know how you could make any statement based upon any of that stuff. X-rays are just going to show you the heart structure. To make a determination like that can only be determined on a CT scan or an MRI. So you don't have any symptoms for any of that stuff, because a lot of times you'd be presenting with different symptomology would give us those indications. I don't see why,
Well, he read my MRI reports, but even still, no. All right,
Give me a
well,
picture. But this is the big deal.
yeah, I'm glad I'm here, okay? That's what I'm going to say. I'm glad I'm here.
But this is the big part of the scoliosis stuff. So first, it's soreness, then it's pain, then it's more pain, and it's more pain. The most important part of this is the same nerves that cause pain and discomfort here. Those same nerves go here, and they affect all the internal organs. And that's the big part of scoliosis, because the latter stages, it turns this stuff off.
The IBS stuff, how does it relate to that?
It's easy. It's like, it's so easy to see where you have.
All right, explain it a little bit.
So right here. So these guys right here affect the large intestine, the kidney, the bladder, the reproductive organs, and the prostate. And so in men. And then where we have, where are you? Right where this bend is, 5, 4, 3, 2, 1, right? That's the apex of the curve. It's right here. That goes right to your stomach. And that's normally what we see is acid reflux first. Acid reflux, IBS, gastrointestinal problems, digestive issues, things just start bloating, they don't move properly, all that. That's and so the other issue, and so if you have a curve greater than 20 degrees, that's why they want to put a rod in there. You don't, but that's normally why they want to put a rod in there, because they know over an extended period of time it will literally cut the nerve flow off from your heart to your lungs, and you'll just run out of gas. So, but that's where you are. So, depending upon what you want, determines where we go.
So if you do all your magical stuff and everything, will I eventually be okay with the IBS, because it's killing my life?
I hope so, but this is the issue. IBS has a trigger. It's called stress.
And we just moved here, and I am stressed. Yeah, it just started this year.
So this is what you have to do to calm that down. So do you have episodes where your stomach like burns, or you have pain or discomfort or pressure?
Pain, bloating, and gas.
Okay.
Yeah.
Okay. So we take care of the neurological component of that. The other part about it is over an extended period of time, the gas and intestinal lining in your tummy changes. And so you have to change that. So you want to drink 2 to 4 ounces of aloe vera with about a tablespoon of acidophilus once or twice a day. And you want to start out slow because it does, sometimes it'll run you to the bathroom, but it'll literally heal the intestinal lining. And it'll stop, it'll change some of that stuff. So that's actually what
Well, I'm taking a probiotic. Isn't that enough?
No, because it's dead. It's a pill, right?
Yeah.
Yeah. You need live.
Oh.
Bacteria. So I don't think we have a Sprouts in this town, but they have it. You want live cultures.
Oh,
And so
boy.
you take it doesn't taste bad. It tastes really good, honestly. Because I used to have it. I had it for 7 years. I went to every doctor in the world. They stuck every tube everywhere, and they came back and, well, you got IBS. And I go. That means you can't figure it out, right? You know, like,
That's what you told me when I said I have IBS.
that's what it means. That it can't figure out. You just got stomach issues we can't figure out. Mine was all stress related.
Can you write that stuff down?
Yeah, I'll give it to you. All right. So a lot of information. Any
Yeah.
questions?
No. I got you on video. I'm going to turn it off now.
Okay, that's okay.